Welcome back. I'm Dr. Sanjay Juneja. I'm a hematologist and medical oncologist, and also known as the Onc Doc. And my hope is to help guide you through cancer and all the processes that are involved, whether you're the patient or a family member. It always helps to be knowledgeable about these things because it's much less intimidating. Today, we're going to talk about staging. So I know there's a lot of misconception about what staging means. Basically, staging is a way for us to have an idea of what are the chances that it's going to come back. Okay, so stage 1 is always the best stage you could be in the sense that it's usually the most limited, meaning you caught it early enough to where it's in one place or it's small enough. Stages 1, 2, and 3 are all in one bucket. You should think of 1, 2, and 3 in one bucket and stage 4 in another bucket. 1, 2, and 3 all means it's local or locally advanced. So it has not left the primary site, right? So if you have lung cancer or breast cancer, it hasn't gone to your liver or your bones. It's still in the general area. And that's very important because for the most part, stages 1 through 3 are curative, or you're hoping for cure. Now, a stage 3 has a higher chance of recurrence for sure than stage 1 across most tumor types. The thing that makes them different is the size, and also, obviously, what cancer you're talking about, and lymph nodes. So lymph nodes for most cancers are considered stage 2 or stage 3. And the reason for that is lymph nodes, or the lymph system, just like your blood system, it's basically a highway for all the fluid to return to your heart. Like if you get swelling in your legs at the end of the day, your lymph vessels bring that fluid back. It's also a nice transport system for a lot of your antibodies or immune cells to fight infection. When a tumor or cancer is growing, one of the first highways it wants to jump on are lymph nodes. And what you're looking at when they jump on, if a cancer jumps on the lymph nodes, is you look to see do those lymph nodes have cancer and how many. Ideally, you do not want it to be in the lymph nodes. You want it to not have even gotten on the highway. It's still in the neighborhood. But if it's in the lymph nodes that are just kind of close to where the cancer are, again, it's probably a stage 2 and 3, and you're hoping to take care of that whole area. When you do have lymph nodes that are too far from where the primary cancer is, then it becomes pretty difficult to just take it all out with surgery, right? We were saying in our first video, surgery is always the ideal option, and a lot of stage 1s you can take out. But once it gets to the lymph nodes and it gets too far, the lymph nodes can be in areas that are tricky, along major blood vessels and stuff that are really hard to remove with surgery. So in general, what we do is we do radiation. So radiation to that area, so if it's the breast or the lung, you're hoping to kill all the cancer cells with radiation. Every time they replicate, it breaks up that blueprint to help them replicate over time, which is why you do radiation for 5 to 6 weeks. But in general, when you have lymph nodes or a locally advanced cancer, in general, you're kind of trying to do radiation and chemo together in hopes for a cure. But again, stage 3 is a little more likely to come back depending on the tumor type. Then there's the stage 4, and what stage 4 means is the cancer has left and it has gone elsewhere. That's what stage 4 means. So if I have lung cancer and it goes to the bones, it is now stage 4 lung cancer. It is not bone cancer. It is lung cancer that left and went and is now in the bone. And that qualifies me as having stage 4 lung cancer, meaning my lung cancer started there and it has gone to a different site. 15, 20 years ago, if you said you had stage 4 cancer, it means you're done. You think like they have a couple of months to maybe a year or so, and that's the best we got. But what we're going to talk about in a different video is now stage 4s do not necessarily mean incurable, and it definitely doesn't mean that you're dying in the next couple of weeks or months. And we'll get to that in a second, but I will say stage 4 for head and neck tumors as well as for lymphomas. So when we talk about lymphomas, that's a blood cancer. Those two both are considered still curative depending on where they are in the stage 4, and we'll get to that in a moment. Please hit the subscribe button if you're interested in this material and you want to help support somebody that's close to you or a loved one, or especially if you're dealing with this. I really believe the more you know, the more it helps, and it just makes things less intimidating. Also, please let me know in the comments what you want to know videos about, and we'll try and address them soon. Take care.